Welcome to The Explainer. Today we're diving into a really fascinating study that kind of flips our usual assumptions about treating chronic pain on their head. It forces us to look past the symptoms and actually listen what patients are saying they value most. I know, it sounds like a trick question, right? For years, the whole point of pain management has been, well, getting rid of the pain. But what if the patient experience tells a completely different, much more interesting story? That question is really at the core of what we're talking about today. Now, to get to the answer, first we have to really wrap our heads around the problem. We're focusing on chronic pelvic pain syndrome, or CPP, a condition that's, incredibly complex and just deeply frustrating for both patients and the doctors trying to help them.
The official definition tells you the challenge right away. We're talking about this persistent, long-term pain that often shows up without any clear, identifiable cause. You can imagine how that ambiguity alone is a huge source of distress for anyone going through it.
And the scale of this problem? It's just massive. Depending on which study you look at, the prevalence of CPP in women is anywhere from just under 4% to, get this, over 43%. This is not some niche issue. It's a major public health concern affecting millions. And here's what's so critical to understand. CPP is so much more than just a physical thing. As this study confirms, it seeps into every single corner of a person's life. It affects their thoughts, their relationships, their emotional state, even their ability to just go out and be in the world. All this leads to what so many patients call a diagnostic odyssey. Think about it. Months, sometimes years, just bouncing between different specialists, going through endless tests, all while feeling completely misunderstood and unheard. That journey itself becomes its own kind of trauma. So with that as the backdrop, how in the world can we improve care? Well, a recent study from the Netherlands went looking for the answer in the most obvious place. They asked the patients. This research comes from Radboud University Medical Center. They've set up a specialized care pathway for CPP, and they wanted to know, from the patient's point of view, what was the real value of their multidisciplinary consultation, or MDC? The method they used was really straightforward but so powerful. They just sat down and did these deep dive interviews with 10 women who'd been through the program. The goal wasn't just to count things, but to really listen to their stories and find the deeper meaning in the care they got. And this is where it gets really mind-blowing. The study uncovered something so profound, a finding that pretty much turns the traditional goals of treatment completely upside down. This simple chart reveals the core discovery. Patients walked in hoping for a cure, right? An end to the physical pain. But what they walked away valuing most was something totally different. It was the power of recognition, that feeling of being heard, of being understood, and of being validated. This quote from one of the participants, wow, it just says it all. After this long, frustrating journey, the simple act of being taken seriously by a team of experts was, for her, transformative. It was the moment that huge emotional weight of the diagnostic odyssey finally started to lift. And here's the crucial takeaway. Even when the consultation didn't make their physical pain go away, it was still seen as incredibly valuable. That validation, that comprehensive assessment, that simple confirmation that, yes, your suffering is real, that was the real therapy. Now, this insight isn't just a warm, fuzzy feeling. It has massive implications for how we actually design our healthcare systems. If recognition is the key, how do we deliver it earlier and make it more effective? The study suggests a total redesign of the patient journey. Instead of the fragmented system we have now, where a big team consultation is a last resort, they propose moving it right to the very beginning. That means one single entry point, one big team assessment, and a personalized plan from day one. And this wasn't just some academic idea. When they presented this to the patients, their response was unanimous, 100% agreement. They all confirmed that this front-loaded, integrated approach would have been a game changer, preventing that long, demoralizing search for answers they all went through. So, what does this dream team actually look like? Well, the study identified this core group as essential. It's a truly holistic team that attacks the condition from every angle: the physical, the neurological, the musculoskeletal, and the psychological. All of them working together with the patient from the jump. But beyond the process and the structure, the interviews revealed one more critical element. And you know what? It all comes down to the human factor. This participant captured it perfectly. It just speaks to the huge impact of having dedicated, empathetic professionals. Patients didn't just value the team's expertise, they valued their humanity.
They felt cared for by people who were, just like the quote says, the right people in the right place.
And that leaves us with a really big question to chew on. In our constant search for new cures and advanced procedures, have we maybe underestimated our most powerful tool? This study suggests that for patients with these complex, chronic conditions, the feeling of being seen and heard isn't just a nice to have, it might be the most important intervention we have. Thanks for joining us for The Explainer.